Welcome to 518 Thrives Healthcast, where medicine finally makes sense and maybe even gets a little fun. I'm your host, Dr. Disha Spath, internal medicine physician and founder of Thrive Direct Primary Care. And this is the show where we break down real health topics, ditch the medical jargon, and talk about what actually matters for your life, your family, and your future. In each episode, we bring you relatable stories, straight answers, and local experts from right here in the capital region. Because healthcare shouldn't feel confusing, intimidating, or out of reach. It should feel human again. Let's get to it. Welcome back to the 518 Thrives Healthcast, the show where we bring you real health conversations, practical education, and local experts to help you and your family live healthier right here in New York's capital region. I'm your host, Dr. Disha Spath, internal medicine physician and founder of Thrive Direct Primary Care. We're talking about a topic that affects millions of families, but it's still widely misunderstood: Parkinson's disease. I'm excited to welcome today's guest, Dr. Kathrin LaFaver, a neurologist with expertise in movement disorders and Parkinson's care. Dr. LaFaver, welcome to the show.
Thank you so much for having me.
Oh my gosh, I'm so excited to have you here live in person in our studio. Before we jump into the heavy science stuff, we'd like to start with a fun icebreaker segment just so we can get to know you a little bit. You ready?
Sure.
All right. First question, coffee or tea?
Oh, that's not a question. Both. I like to start my day with coffee and I drink a lot of tea later in the day.
Oh my gosh, yes. More caffeine, the better. Especially in the winters. Like anything warm, I'll take it.
Absolutely.
I love it. Okay. If you weren't a doctor, what would you be doing?
I probably would be a psychologist, and it's pretty
the
closely related to neurology. But I really like to understand what makes people tick, how they make decisions, and so on. So I'd probably still be in a related field.
That's actually really interesting. Yeah, because I feel like neurologists are very much, very scientific, and psychology, it's still a science, but it's more of an arty science. It's like more of a feel. You have to go with what you feel a little bit more. And I like that you're able to work both sides of your brain.
Absolutely. You're right. In neurology, we learn all the hard facts, but neurologic diseases really go to the core of what a person is. So in clinical practice, we always try to address the whole person for sure.
Love that. All right. Final icebreaker. What's one Parkinson's myth that drives you absolutely crazy?
Oh, that's a good one. I would say the biggest misperception that people bring to me is that they need to delay treatment of Parkinson's disease. And this information must be out there on the internet because a lot of people will tell me the medication like levodopa will only work for a certain number of years and then stop working, which is not correct. And
I've never heard that before.
it's so interesting because there's so many good sources of information like the Michael J. Fox Foundation, the Parkinson Foundation, but there's still a lot of people who somehow read that Parkinson's treatment should be delayed because the treatment will not work long term. And anyway, that's my biggest myth I'd like to dispel.
Yeah, see, and that's exactly why I want to do this show, is because I feel like people get their information off of social media, and a lot of times this stuff gets amplified, like wrong information gets amplified just through the same people saying the same thing over and over again without any like scientific verification. And doctors and what we learn, what we're listening to, the facts that we're processing, that often stays completely out of the social media conversation. And so this show is my attempt to put our perspective into the social media conversation and hopefully some very solid science facts, right?
Wonderful. I'm happy to be here.
Yeah, I'm so glad to have you here. Well, let's get going. So I want to start with a totally fictional patient case. Tom is a 58-year-old. He lives here in the capital region. He works full-time and considers himself pretty healthy. Over the past year, his wife starts noticing subtle changes. His hand trembles slightly at rest. He's slower to get out of chairs. His handwriting has gotten smaller. He feels more fatigued. And he's lost his sense of smell. At first, Tom brushes it off as stress and aging, until his primary care doctor refers him to neurology. Dr. LaFaver, when you hear this story, what stands out to you?
So in this story, there's many, many typical features for Parkinson's disease. And it's interesting because I hear this sometimes from patients who come and see me for a second opinion, and they'll say, the first neurologist I saw, they barely looked at me. They just told me I have Parkinson's disease and I should start a medication. And it goes to kind of a fact that a lot of the signs for Parkinson's are for a trained eye are very obvious. So, for example, having a new onset tremor that often starts on one side of the body, shuffling gait, stoop posture. So one can really pick up pretty quickly,
Right.
and yes, and there's not many things that really mimic that. So that's why it's for a trained neurologist. It's really a very quick diagnosis often to make.
Right, yeah, and, you wouldn't think get the handwriting getting smaller, right? For an untrained eye that would be a thing, right? But handwriting often is a very key indicator for a lot of our neurological illnesses. Would you agree?
Yeah, so the main diagnosis we often differentiate Parkinson's against is a different form of tremor called essential tremor. And that leads more to shaky handwriting, actually, and a lot of tremor when people do things with their hands, such as eating or drinking, versus with Parkinson's disease, the tremor is more noticeable when people sit and are at rest.
Mhm.
And then the handwriting changing in size, specifically becoming smaller, is very typically seen in Parkinson's disease.
That's interesting. So with essential tremor, you would see, like, a really jagged handwriting that would be hard to
Exactly.
read, but it
Yep.
wouldn't just be smaller.
Correct.
But in Parkinson's, it would be smaller, but still, like, perfectly
More
legible.
legible. Exactly. Yep.
Interesting. What exactly is Parkinson's?
That is a very good question, and there's not a simple answer, but I'll try to touch on a few points.
Sure.
So the core of Parkinson's disease is loss of dopamine producing neurons in the brain.
Mm.
Dopamine is a neurotransmitter that helps with movement and among other things. And the reason why this happens is still not completely understood. There are some cases of Parkinson's disease, and actually around 15% that are genetic in nature. So those are cases where Parkinson's can often run in the family. Those are often also people who get it at a younger age and might have other particular features about them. But most of the time, Parkinson's is more of a disease of aging, and there's sort of cellular processes like the wastebasket systems and the cell stop working as well. And so there's abnormal accumulation of a protein called alpha synuclein that kind of clogs up the cells and is a way kind of to think about it, and just kind of slows some of these processes down. So then this happens, people get the tremor that we already talked about, but also slowness of movements and stiffness. So that might manifest as trouble getting the arm in a sleeve in a jacket, or trouble with closing buttons,
Hmm.
whisking an egg. So
Right.
doing kind of fine motor movements or movements that have kind of repetitive motion in them. Back to your question, there's not one simple answer, but it's basically an energy issue in certain cells that produce dopamine, which can lead to a whole host of symptoms.
So that's so interesting. Most people associate dopamine with feeling happy and the emotional side of the dopamine transmission, but now we're talking more movements. So this is more in the movement center of the brain, right?
Correct. So yes, so dopamine is very key for moving smoothly, and but with that being said, dopamine is in fact also very important for emotional regulation. And with that in mind, people with Parkinson have a much increased risk of depression and anxiety,
Mm.
of up to about 70-80%, which can actually be early features of a disease.
Yeah.
And I've seen people in my practice who did not struggle with things like depression, anxiety earlier in life, but a few years before they started developing a tremor, the family did notice that they had been more anxious, for example. So it often does go hand in hand.
Yeah. And you often get this like masked faces with Parkinson's, right? Where they don't have as much expression. Do you think that is part of that?
Yeah, it's interesting because part of it is, so that's kind of probably more of a movement side of it.
Uh-huh.
And these kind of the movement that happen automatically are usually the ones that are decreased in Parkinson.
Mhm.
So, unlike a situation where someone has a stroke and, for example, has complete paralysis of one side of their body, people with Parkinson are able to move. They just move slower and it takes a lot more effort.
Right.
And so that's kind of what happens with phase 2, like sort of facial animation, smiling, laughing that people do typically without thinking about it, can be reduced. And
Mm.
so people can look more depressed, and they might be more depressed, but it is also a reflection of sort of a slow movement or paucity of loss of movement.
Got it. Okay. All right. Does Parkinson's happen suddenly or does it develop slowly over time usually?
Typically develops very slowly over time. And so it's actually recognized, but there are many what is also labeled as premotor features.
Mhm.
So, for example, people often lose their sense of smell, maybe even 10 years before they develop other features of Parkinson.
Interesting.
And so the reason for that, there's at least this theory that has some pathological backing that there might be environmental triggers that get into the body through our nose and mouth. So there's a might be a trigger that changes these proteins we talked about, these alpha-synuclein proteins, and then we ingest these particles through the nose. Can affect the olfactory fibers and lead to loss of smell.
Interesting.
So loss of smell is often a common early feature of Parkinson, as is constipation. And that is also felt that these particles that might be trigger factors get into the body through the GI tract.
Oh, interesting. So do we know what these triggers might be? Do we have any idea?
We do. And interestingly, it's more and more recognized that it's not just kind of a coincidental process and just, oh, we're just getting old and our cells slow down.
Mhm.
But it's more and more recognized that actually toxins in the environment, specifically pesticides, other chemicals, might be frequent triggers for Parkinson's.
Okay. Well, clean living is very important, and I think everyone can agree on that. So I think all the corners of the internet would agree with trying to stay away from pesticides and toxins, right? The question is, how do we do it? Right?
Absolutely, and it's easier said than done, and it's also true that toxins we were exposed to decades ago can have slow lasting or slow starting impact many years later.
Right.
So we can't change the past, unfortunately.
Right.
But Parkinson's, for example, is also recognized as a service-related disability by the VA.
Huh.
So, for example, veterans who have been exposed to Agent Orange can claim this as a service-related disability. But there's more and more clusters of Parkinson's, and including here in New York State, Hudson Valley. So many places that have had pesticide exposure through agriculture,
I see.
but also chemical exposures, for example, from dry cleaning sites, other chemical waste sites. And, the more I actually ask people in my practice about their profession, I often do find sort of a pattern.
Hmm.
I just recently had a patient in my practice where both he and his wife got Parkinson's disease,
Oh
which,
gosh.
was sort of unexpected, but they
Yeah.
lived close to a dumpster site and had agricultural exposure to pesticides. So unfortunately, these patterns do play out more and more. And, yeah, I mean, of course, going forward, there are things we can do. From a society standpoint, we can advocate against the use of known toxins like paraquat and other pesticides. And of course, in our personal lives, we can try to limit the pesticide exposure.
Right.
And this is maybe a good chance to make a plug for a recently released book by doctors Ray Dorsey and Michael Oken. So, for some of the leading Parkinson doctors, I would say, in the US. And there's a really nice book published last year called The Parkinson's Plan, where they actually put together some of these actionable points we can all do to minimize the risk for Parkinson's and even if you already have Parkinson's, to potentially slow the progression.
Wow. Okay, wonderful. We'll definitely include a link to that book in the show notes. So thank you so much.
Sounds
So do you think we're seeing more cases now than you have, say, at the beginning of your career?
I would say yes, and, Parkinson's is actually the fastest growing neurodegenerative disorder in addition to Alzheimer's disease, and part of it is that we are getting older, the population is getting older,
Right.
but I would say that, yes, that these man-made, exposures definitely play a role. There's also some data even on air pollution being linked to neurodegenerative disorders.
Mm.
So we currently have about 1 million people with Parkinson's in the US and about 6 million worldwide. But the numbers are predicted to grow exponentially in the next 20 years. So we are we are trying, like what we do today, raising awareness on some things we can do to potentially minimize the risk, because there's a lot of fear that the numbers are really grow even more than we see today.
Yeah, I mean, the fear of losing one's mind and of facilities are it's one of the scariest things, right? You can do all the things right otherwise and, lift weights and exercise, but if you lose your mind, then, what's that good for, right? And you don't even know what's happening. It's a scary thing. So I'm definitely very glad that we're talking about this and trying to prevent it, as much as possible. So many people think of Parkinson's as just a tremor, but there's so much more to that. What are some of the earliest warning signs that you're developing Parkinson's?
So some of the earliest signs, as we had briefly mentioned before, is this loss of smell
Right.
and constipation.
Hmm.
And there's another interesting phenomenon. It is called a REM sleep behavior disorder. So, what that means is that people can have a much more restless sleep than they used to. So, we all go through different stages of sleep each night. And one of these stages is called REM sleep, and that's usually when we dream.
Mhm.
Now, typically, when we dream, our muscles are actually paralyzed. So we do not jump up and chase the lion if we happen to
Right.
dream of being chased by a lion. In REM sleep behavior disorders, that feature gets lost, and people actually start talking during their sleep, often yelling and acting out their dreams, is what the technical term for this is.
Hmm.
And this, again, can be an early manifestation of Parkinson's disease.
Okay, so now let's talk about diagnosis. We talked about, most neurologists can just look at someone and see that they have Parkinson's, but is there any specific testing that you do as well?
Sure. So the main, the kind of a cornerstone of diagnosing Parkinson's disease remains based on the history and clinical examination. So specifically, when we get someone's history, we ask about a lot of these features that we just kind of mentioned, like loss of smell, like changes in handwriting,
Mhm.
changes in walking and balance, the tremor, things like that, and we see these things on examination. Now, in addition to that, there are indeed more specific tests. So there is a way of actually looking at dopamine receptor binding or dopamine levels in the brain to kind of simplify it a bit. And this is what is called a PET scan. So it's a specific scan that people can do where we can deduct if there is indeed loss of dopamine present in the brain or not.
Okay.
There's other ways now to look at these abnormal proteins that we talked about. So these abnormally folded alpha-synuclein levels.
Mhm.
And one of the most interesting developments has been a skin biopsy,
Oh,
where the pathology can differentiate if someone has Parkinson's disease or not. Now, we don't routinely order these tests for a lot of times. It would not necessarily add to someone's care,
sure.
but if the someone's diagnosis seems to be less certain, they have some sort of atypical, unusual presentation,
Mhm.
or they do not respond well to treatment, those are the tests available. So either a dopamine transporter scan or a skin biopsy. There's new developments too, where people really try to see if they can look for markers in the blood and even in tears and other body fluids. But this is not quite ready for prime time, so that's not an option. Blood there's to date, there's no blood test for Parkinson.
Got it. So the skin biopsy, would it be any part of the skin? What do they biopsy exactly?
It's a pretty standardized protocol. One biopsy is taken at the back of the neck, and the thigh and the ankle.
Huh,
Mhm.
interesting. Very cool. And, is that testing available in the 518 in our region?
So New York State is one of the states that has a bit of a different regulations for laboratory tests.
Okay.
So we do not offer it routinely quite yet.
Okay.
If you go to one of my colleagues in Connecticut, they will. So,
Okay.
but I expect that within this year or next year, we will be able to order this on a more routine basis.
And this meaning the skin biopsy.
The skin biopsy,
Yeah.
exactly. The dopamine transporter test that is ordered on a routine basis.
Okay, great. Awesome. And yeah, I've seen it done in Albany Med, right?
Yeah,
Is that the
so
only center around
it
here?
is, yeah, and it has to do with the agent that needs to be injected is pretty unstable, so it's difficult to store.
I see.
So unfortunately, Albany Medical Center would be the only place where people can go for that dopamine transporter scan.
All right. Quick pause before we continue. If you're listening and thinking, gosh, I really wish I had the time with my doctor to talk about symptoms like this, that's exactly why I started Thrive Direct Primary Care here in the capital region. At Thrive DPC, we offer same week or next day appointments, even same day appointments, longer visits, not rushed 7-minute encounters, direct access to your doctor by phone or text, transparent monthly pricing, no insurance middlemen, and we focus on prevention, early detection, and real relationships, not volume medicine. So if you want healthcare that actually feels human again, visit thrivedpc.com or follow us at 518 Thrive Health. What are some treatment options available today?
So interestingly, the mainstay of treatment through all these years has remained carbidopa-levodopa.
Right.
So we talked about the loss of dopamine being really important for many of the symptoms. And levodopa is a proform of dopamine that gets converted in the brain.
Mhm.
And in the combination with carbidopa, it basically breaks down the avoid side effects. So it's a combination product.
Mhm.
And this medication has been available since 1975.
Right, it's an oldie but goodie.
So we have a lot of experience of it, and it remains actually the most effective medicine and is generally also the best tolerated.
Good to know. Is it more effective if you start it early versus late? You talked about this a little earlier. So what's the answer to that?
Yeah, so it's not actually more effective necessarily. However, the goal for treating Parkinson's is really to give people the best quality of life at all stages of the disease.
Right.
So, treatment really should be started when someone is having impairment in their daily function because of their symptoms. So, with that being said, sometimes I do see people in my clinic with very, very early symptoms, and they just want to know what they have, right? They want an answer, but they don't feel it's really slowing them down. And so we don't always start treatment. But if they are impacted in their daily function, then that was sort of my earlier point that there's no reason to delay it. And then besides carbidopa, levodopa, there are now a big growing number of additional medications that can often be helpful to be added on and support the role of levodopa. But for the most part, they are kind of coming on a bit later in the process when symptoms progress.
Got it. What are the most common side effects of this medication?
So I always say, ideally, the side effect is feeling better and being more functional. But with that being said, so there can be some nausea and dizziness, lightheadedness with this medication. The lightheadedness part can often be related to drops in blood pressure.
Okay.
And that's another feature of Parkinson we haven't mentioned is the autonomic nervous system.
Right.
So Parkinson can lead to lower blood pressure, to actually other issues of constipation. We talked about bladder issues,
Right.
but so especially the blood pressure the medication can worsen this issue, and nausea can sometimes happen, and some people are more susceptible to that. It often gets better with time, but once people get a bit more used to the medication.
Okay. Good to know. How effective are these medications or this medication?
Yes, so I would say the carbidopa levodopa specifically is initially very effective, and it's sometimes been dubbed one of the miracles in medicine because a lot of times people will really come back and say they feel very close to their quote unquote normal self or how they've really felt before they started with this disease process.
Oh,
And then, of course, this is not a cure for Parkinson's. So, unfortunately, we do not have a cure, but the medicines can really help tremendously with improving the symptoms. So, it's always a little bit expectation setting because the medication will also not address all the symptoms. For example, the loss of smell that we mentioned or the changes in the handwriting, they will not necessarily improve
I
with
see.
medication. So, what the medications that we currently have available mostly help with is the movement aspects of Parkinson's.
Okay.
So, the slowness, the shuffling gait, and the tremor.
Okay. All right. What role do physical therapy, speech therapy, and exercise play?
Very important roles, and I love this question. So I always will tell people that in addition to the medication, the best thing they can do for their Parkinson is really exercise. There have actually been studies, and there are studies ongoing showing that people that who exercise on a regular basis have better quality of life, better symptom management, and exercise might actually slow the progression of Parkinson, which is very exciting
Yeah.
and is unlike of any other intervention we have.
Right. Now, is this any particular kind of exercise? Cardio, weightlifting?
Yeah, so in general, it's actually recommended to do a combination of different exercises.
Okay.
And there are certain guidelines available. For example, the Michael J. Fox Foundation, Parkinson Foundation have some links on their websites. But it's generally best to kind of stick to the regular US guidelines for exercise. So half an hour, 5 times a week, kind of gets 150 minutes of more aerobic exercise per week. And then also add some strength training and balance training.
Nice.
For physical and speech therapy specifically, there are Parkinson specific modalities. So they're also called the big and loud therapy. And what they specifically aim at is coaching people to make their movements bigger than they think they should. And similar with the voice, because their own brain gives them wrong information. So it's a bit of a scaling problem. Their voice sounds normal to themselves, but their family members have a harder time understanding them.
Hmm.
So what they learn in speech therapy is really to project their voices more.
Interesting. Now, for cardiac, post cardiac patients, we have cardiac rehab. Do we have like a Parkinson's rehab in the 518 somewhere?
So there's many therapists that are specifically trained in the big and loud therapies. So yes, with the Saratoga system, there certainly are many therapists. Glens Falls Hospital has also therapists trained specifically for the big and loud program.
Wonderful. So, as a primary care doctor, I have a lot of people coming to me asking me, especially if they have a history of Parkinson's in their family, how can I prevent Parkinson's disease from even onsetting? So, are there any lifestyle habits or changes people can make to prevent Parkinson's disease from coming on?
Yeah, so I like to say what's good for your heart is good for your brain. So a lot of these healthy habits go back to diet and exercise.
Nice.
And as far as what is the healthiest diet for Parkinson's disease, there are not a lot of studies looking at Parkinson's disease specifically, but there are studies looking at Alzheimer's disease and general cognitive health, and there are a lot of similarities. So more Mediterranean style diet, more whole foods, avoiding processed foods, ultra processed foods. That's sort of more in everyone's mind now or media. So people
Right.
have more conception of what that exactly means. But yeah, sticking more to foods that are more unprocessed and again incorporating fruits and vegetables as much as possible. So that definitely has benefits.
Right. Free of pesticides.
Yes, ideally, if we have, organic is
Right.
best, but I think it's just or at least washing the fruits and vegetables well before eating,
Right.
consuming. That's really important.
Yeah.
And then back to the exercise, we talked about how exercise can really be powerful for people already diagnosed with Parkinson's disease. but it's also really important for primary prevention of neurodegenerative disorders. And there's, actually big population studies. So there's, like, the nursing study is kind of a famous one that looks at a large group of nurses from midlife to late age, and, people that are more, regular exercising, generally decrease their risk for neurodegenerative diseases.
Interesting. And what about alcohol? Alcohol obviously in too much is bad for everyone. There are some studies out there showing that a glass of wine is good for heart health. Red wine. How does that interact with the Parkinson's risk?
Yeah, unfortunately, I can't really, recommend alcohol per se. I wouldn't discourage someone from having a glass of wine here and now, but in general, there's no benefit from alcohol in this regard, and we like to say that alcohol really is a neurotoxin, and in addition to brain health, neuropathy is also an issue that affects many, many people, and, people are often surprised that having 1 or 2 glasses of wine per day is actually bad for things like their neuropathy.
Good to know. Yeah, and that's not something that you would necessarily think about. Neuropathy in your feet and hands is getting worse with alcohol, but absolutely, it makes total sense.
Yeah.
All right. So, new breakthroughs. So, this is the exciting part. What breakthroughs are happening right now in the world of Parkinson's?
There are many new advances that are exciting. For one, the delivery of medications like levodopa has changed, and we now have levodopa pumps, for example,
Huh.
where people can get sort of a under the skin delivery system of levodopa, which is more sustained over time. So those are new options for people with more advanced Parkinson's disease that can have advantages. And then I would say the main scientific developments or scientific discoveries have been surgical treatments for Parkinson's disease, such as deep brain stimulation. Their electrical wires are put in the basal ganglia, the movement areas in the brain, and can have many benefits for people, again, which is typically more needed in more advanced stages of a disease.
Yeah.
Another really hot topic have been stem cell therapies for Parkinson's disease, and have shown or are shown big promises in sort of restoring dopamine producing cells or supporting factors in the brain that basically keep cells from dying.
Oh, that's awesome.
So I would say there's probably much more to come within the next 5 years or so that might really be a game changer for many people with especially more advanced stages of Parkinson's.
Oh, that's so exciting. I actually worked on the Human Genome Project, stem cells, neuroembryonic ones, that looking to help with Parkinson's and Alzheimer's disease back in my college days. And so it's good to know that it's being put to use and hopefully hitting the market soon.
Yeah.
How about wearables? A lot of people are wearing these Aura rings and Apple Watches. Are you seeing more tremors picked up because of these devices?
I can't say I've specifically seen people who came to me and mentioned a device picking up their tremor. However, there are some neuromodulation devices that are designed to treat tremor.
Oh, okay.
So there are a few companies that make sort of watches, for example.
Mhm.
There also was this famous interview on the Today Show with a group at Stanford that made a tremor glove meant to reduce tremor. Now, I would say none of these variables have been complete game changers for people, and typically insurance doesn't cover it.
Mhm.
So their use is a bit limited.
I see.
But for certain people, there may be an option for some of these variable devices to reduce tremor specifically.
Cool. Yeah, I've seen some spoons, but that's more like intentional tremor, the spoons that correct the hand tremor.
Yeah, so right, and again, this is more targeting people with essential tremor, for example,
Right.
or just incoordination issues. So there are these devices that have like a gyroscope and pick up tremor and then move in the opposite direction.
Right. Okay. Wonderful. So for someone listening right now who either has Parkinson's or cares for someone who does, what's the most important advice you would give them?
Well, I would say the most important advice is to try to build a team around you because this is a disease that will stay with you for the long haul. And I think it's definitely encouraging how many treatment options we have for Parkinson's disease. But with that being said, it still affects people in many aspects of their life. And so having a neurologist, of course, can be very helpful in guiding the treatment decisions, but really having a supportive group around you. And for example, Parkinson support groups here locally can be a wonderful resource to connect with other people in similar situations and get advice that kind of exceeds the advice that your medical team will give you and can make a huge difference for people.
Awesome. Yeah, how can people find these support groups?
So the capital area is really blessed with a wonderful group called Help for PD. It's helpforpd.org. And these are individuals who have really come together and built resources that collect information of exercise classes, support groups, kind of all around in the area here. They also do educational events. So there is an event coming up on May 9th on Parkinson's education, but will actually feature Dr. Ray Dorsey from the Parkinson Plan.
Okay.
He'll give a talk about his book. There's actually the YMCA also has really strong group support or group exercise classes for Parkinson's.
Hmm.
There's actually a new YMCA on Wolf Road in Colony
Mhm.
that actually offers free membership for people with Parkinson's and their families.
Oh, wow.
So there's outstanding opportunities to get involved and get engaged. And exercise is even more fun if you do it in a group.
Yeah.
It also helps with accountability. So there's many, many great options to get support.
I love that. Yeah, and that's one of the biggest goals I have with Thrive is creating these group exercise activities just to help people make it a habit. And I love to hear local groups doing good things to prevent and treat illness, and the YMCA providing this free service to people with Parkinson's and their whole families. That's huge. So we'll make sure to tag them on this.
Absolutely.
Yeah. Awesome. Well, let's end with a rapid fire segment. Biggest misconception about Parkinson's.
But it's only a disease that old people get.
Most powerful lifestyle change people can make.
Hands down, exercise.
Yes, I love that. One thing you wish every patient knew before they first came to see you as a neurologist.
It's always helpful to bring a support person with you, as well as an accurate list of medications
Yes.
they're currently taking.
Right, exactly. Oh my gosh, that's the gripe of every doctor. It's like, please know what you're taking or write it down, just bring it in and that or bring in your whole all of your medications with the bottles is so helpful for your medical team. All right, Dr. LaFaver, thank you so much for joining us today.
This was fun. Thank you for having me, and I hope everyone learned something.
Oh my gosh, I think I think this is going to be so helpful to anyone that's been thinking about Parkinson's or has someone in the family with Parkinson's. So thank you. And that's a wrap on today's episode of 518 Thrives Healthcast, where medicine is human, prevention matters, and your health actually makes sense. If this episode helped you, taught you something new, or made healthcare feel a little less overwhelming, share it with someone you care about. That's how we help more families across the 518 stay informed and stay healthy. I'm Dr. Disha Spath, reminding you that the best healthcare starts long before the ER, long before the diagnosis, and long before the crisis. Stay curious, stay proactive, and keep thriving.
This podcast is intended for educational and informational purposes only. The content of this podcast, including discussions with expert specialists, is designed to provide general knowledge about common health concerns and related topics. However, it does not constitute medical advice and should not be relied upon as a substitute for professional medical consultation, diagnosis, or treatment. Any cases or scenarios discussed in this podcast are fictional or generalized and do not reflect real patients or real-life medical cases. If you have specific health concerns, please consult your own physician or qualified healthcare for personalized medical advice. The opinion expressed by the host and guest do not necessarily reflect the views of any affiliated institutions. Any reliance you place on such information is strictly at your own risk. This podcast is a production of TFP Communications, LLC.